Hi, it's Bertha with Be Well with Bertha. I'm a practicing massage therapist and physical therapist assistant. And today I wanted to talk to my fellow massage therapist. I guess even anyone that's in rehab or doing manual therapy. So when I was postpartum with my first child, I had horrible tendonitis, dequere veins, tenosynovitis. I diagnosed myself, but horrible tendonitis along this joint right here. So I did KT tape. That helped it feel stable, gave a little bit of support and relief, but it was really gross because you're getting lotion on the tape, it's curling up. And when you're in healthcare, you're just constantly washing your hands. So it felt gross and it looked gross. I did a lot of scraping. That definitely helped. But I feel like the two other things that really helped me in my progress and recover from the tendonitis was the stretches. I have in an earlier video for your wrist flexors and extensors. So I'll show you from the side. Just palm down and using your body weight to lean back, getting a nice stretch through there. And then the back of your hand, either on a table or on the floor, and doing a nice stretch here for your wrist extensors. So doing those consistently, and then in between the stretches, the wrist circles, clockwise, counterclockwise. Like I think I did like 10 each. I was in some serious pain, so I was being very good with and consistent with my stretches. The other thing that I found I think I found it on the internet or something. I probably could have asked one of my fellow OT friends, but I saw this on, I don't know if it was a reel, but I started doing it and it really gave me a lot of relief and helped me in that recovery process. So it's a joint mob. So what I do is, I still do it today. So I'll take my thumb. So I'm pulling straight, like kind of in line with that elbow. I'm pulling straight out with this hand. I'm pulling my thumb, and then the thumb, my thumb here, I'm pressing straight down. So I'm giving this joint right here, I'm giving it space, and then I'm mobilizing it. I'm pressing down. So I would just do that throughout the day, and let me tell you, it just it gave me so much relief, and I still do it all the time. The other thing I would tell you, as someone who uses their hands constantly in body work, stop using your thumbs. That also was like such a huge thing for me, was to stop using my thumbs for trigger point work. There are better ways. I'm going to do another video on just some different ways I use other parts of my hand, forearm, for body work, and I do not use my thumbs anymore. It was a learning curve because I was used to using my thumbs. It was kind of the lazy way to do it. But after having tendonitis like that, I figured out better ways to work on those trigger points, to apply pressure to certain areas. So I really don't use my thumbs a whole lot, and I have not had tendonitis since. After my second child, I came back doing massages, and I also do manual work with physical therapy, and never had any tendonitis. So I'm very thankful for that. And I think a lot of it is because I changed the way that I do massages. But try these. If you're having those problems, try these and let me know if they help, what you think of them. And I hope that you have a blessed day and you just keep enjoying your work and do the things that you have to do to be well and continue to have longevity in your career. So you have a blessed day.